It's so long. Hello and welcome to the Board of Health meeting for May the 7th, 2019. I would like to remind everyone that our meetings are web streamed and televised, and for those in attendance, I would ask that you ensure your phones are on silent mode. This is a fairly lengthy Board of Health agenda today, and our council and committee meeting must commence at 3 o'clock. So if we don't finish the Board of Health meeting by that time, we will either recess and reconvene following CIC deputations, or we will adjourn and decide on a place and time to deal with the remaining Board of Health items on the June Board of Health agenda. First of all, disclosure of pecuniary interest. Are there any declarations of pecuniary interest today? Okay, seeing none. Approval changes to the agenda. There are a couple of minor amendments to the Board of Health agenda. The first is that we will hear first from the Medical Officer of Health update under the presentations, and then we will have a presentation by Frank Woodcock, the Pathways for People, which was item 5A, and Mr. Woodcock will present at the Council and Committee meeting following the Board of Health. It's not correct?
So thank you, Madam Mayor. We're actually going to have Jamie Stuckless do the presentation from the Bicycling Coalition, and then once we've done that, we'll go into the report and our presentation, and then I understand that Mr. Mr. Woodcock will then do his deputation during council. Thank you. My
perfect.
Apologies for that.
Thank you. Okay, in that case, are there any other changes from board members? Seeing none, if I have a motion before me, that's been moved by Board Member Ravitz and seconded by Board Member Columbus that the agenda be approved as amended. All those in favor? And that's carried. There are no consent items today, so first we will move on to the Board of Health meeting minutes. Are there any errors or omissions? Okay, if not, the Board of Health minutes for March 19th, 2019, having been circulated and no errors or omissions reported, be declared as adopted and signed by the Chair and Deputy County Clerk and affixed with the corporate seal. Our first presentation, then, moving on, will be from Shanker. I still can't do it. We're going to call him Dr. Shanker from now on. Our Medical Officer of Health.
Madam Chair, members of the Board of Health, thank you for allowing our team to come today and share some of the work that we're doing in the public health service. I wanted to talk about two items today. There are 1,250 people who died of opioid-related deaths in Ontario last year. There were 7,700 emergency room visits, and there were about 2,000 hospitalizations. So to place this in context, there are about 350 people in 2018 who died in motor vehicle crashes. So in our province, there are more people dying of opioid-related deaths than motor vehicle crashes. I wanted today to share with you a document that came across my desk, and I think it's actually a very penetrating document. This was a survey of coroners and medical examiners, and in the parlance of medicine, they're the people who process death. They're the individuals who deal with people who die and how to address the issue of the bodies and investigate deaths. And I'm just going to quote from what the different medical examiners and coroners said. So one coroner said, "I have seen it from all walks of life, though. I've seen it from some of the wealthiest families to some of the poorest. Yeah, it does strike across all lines. It concentrates us in certain areas, but is by no means limited to that." And another medical examiner said, "The most prominent thing is poorly managed or unmanaged mental health issues." I thought this quote was particularly striking. And these are hardened people. These are people who are processing death. Most of the people that I've gone to have died alone. They die in their bedroom, or they die in their living room, or in the bathroom, and the majority of them have no one to call or sound the alarm. And I'll just leave you with one other quote, and this is a challenge we face in our health district and across the province. And this one coroner said, "There's no quality control when you buy illicit drugs." The reason I share that with you today is that you will hear today from our team about the things that the Public Health Service is doing to try at least to address and mitigate the use and misuse of opioids. The second thing I wanted to talk about was something that's core to our mission in the Public Health Service. So public health is different from the practice of medicine. We're interested in trying to advance the health of communities and of populations as opposed to individuals. When you go to the doctor, it's about the person in front of you. When we deal with the Public Health Service, we're working on trying to improve the health of communities. And when we think of prevention, there are two, although there are many different ways, there are two primary things we think of in prevention. One is primary prevention, and that's preventing illness or disease before it's clinically apparent. So it's trying to reach out to people that are apparently healthy today. And secondary prevention is what we typically think of in medicine, whereas a person is sick and how can we get them better? Today, we're going to talk, and the team is going to talk about a component of exercise as a public health intervention. But I want to share with you something that may not be well understood or well recognized. We've known that exercise and physical activity is a positive thing for health for 50 years. And one of the first ways we discover that, or we know that, is by a study that was done in the 40s. And it was done on double-decker, people who work on double-decker buses. Now, why is that? Well, when in London, in the UK, when people join the bus service, some people get assigned to driving the bus and some people get assigned to being a conductor. And the conductors travel up and down the stairway. And the same group of people who become conductors become bus drivers. They're almost randomly assigned. And at the London Transit Service, they followed 31,000 men for an extended period of time. And those men who worked as drivers had about a third more heart attacks than those people who were conductors. Same people, just the difference was physical activity. And the conductors, if they did get a heart attack, got a more benign variant. They were less likely to suffer. So that was the first real window into why physical activity might make a difference for people who are apparently well. And that was followed by another study of Harvard University graduates, about 30,000 of them. And those people who walked 50 steps on average had a 25% reduction in cardiovascular disease. So with that, it's been 50 years from us understanding that physical activity might make a difference for health, and we're still working on executing on that plan. So today, I think you're going to hear a very exciting presentation about how we can make our community more friendly for bicycles, which is a key thing or a key component of advancing physical activity. So with that, thank you for the time, and hopefully we'll stay on schedule today. Thank you.
Great. Thank you, Shankar. Okay, next is, I know an award that we are all so excited to be receiving today is, first it's going to come through Staff Report HS 19-20, and it's in regards to the bicycle-friendly community designation. And I believe Jamie Stuckless will be presenting, making the presentation.
So thank you for, is it on? Okay. Thank you for that introduction. I'm Callie Anderson. I'm a health promoter from the health unit, currently working in the active transportation and built environment portfolio and on some of the bicycle-friendly and activities and initiatives. So the purpose of this presentation is to announce that Norfolk County has been awarded a bronze level bicycle-friendly community designation by Share the Road Cycling Coalition. And the Share the Road Cycling Coalition is a provincial, not-for-profit cycling advocacy organization that works to build a bicycle-friendly Ontario. And if you could advance the slide. So after receiving an honorable mention in 2016, along with a feedback report of key recommendations for moving forward, an interdepartmental committee was formed and staff from various county divisions were identified to work on implementing some of the select recommendations. And in 2018, a second submission was made, resulting in our bronze level award. And the Bicycle Friendly Community Award demonstrates Norfolk County's collaborative efforts towards improving cycling infrastructure and culture locally, and it sends a message to residents that quality of life matters in our community. And at this time, I'd like to introduce Jamie Stuckless, which is the Executive Director of Share the Road, to discuss the Bicycle Friendly Community Program in a bit more detail, some of the highlights of our application, and recommended next steps.
Thank you very much, Callie, and thank you for having me here this afternoon. So I'm here to congratulate you on now being one of 42 municipalities in Ontario to have been recognized as a bronze, silver, gold, platinum, or diamond bicycle-friendly community. So congratulations on your efforts. This is a program that is available for free to all municipalities thanks to our partnership with the Canadian Automobile Association. Municipalities submit an online application which is judged by our expert panel of judges against the criteria that we call the 5 E's of being bicycle friendly. So we look at what you're doing in terms of engineering, education, enforcement, encouragement, and evaluation and planning. So in terms of why Norfolk is receiving the award this year, we were particularly impressed with your excellent network of trails, which is helping residents and visitors get on their bicycles. You're also running some really great events and encouragement programs in the community, like the very popular Tour de Norfolk bicycle ride. And you also have really strong local partners working in the community, like Pathways for People and the various mountain bike clubs that are working with the county to get people on bikes and make it safe and convenient to do so. So not every community that applies for the award receives an award, but every community does receive our detailed feedback on how we can work with you to get to that next level. So we want to work with Norfolk to become a silver, gold, platinum or diamond community. And I will mention that in Ontario, there's not yet a platinum or diamond community, so there's still opportunity for Norfolk to be first. So maybe let's do that. So in terms of the next steps and recommendations, so we mentioned that one of the things really happening here in Norfolk is the strong partnerships with the community. And in comparison to some other communities, Norfolk's efforts really are currently being led by those community groups, so we think there's an opportunity for county staff in a more official capacity to engage in supporting the initiatives and growing the cycling community. We'd also like to see Norfolk invest in building a stronger network of infrastructure within town centers and popular destinations, particularly making sure that that last kilometer or 2 connection from the trail to the destination is available to people cycling. We'd also encourage you to look at working with your local school boards to run school travel planning and make sure that cycling and walking is a safe and accessible choice for families in your community. And we'd encourage you to look at some fun events, like maybe having some counselor-led bike rides in your neighborhood to explore local attractions with your residents. And lastly, we'd encourage Norfolk to set some really measurable targets for bicycle use in Norfolk, so you can map out a plan of where you'd like to be within the next 4 years and have some annual reporting on progress towards those targets. So thank you for your time, and I'll hand it back over to Callie.
Thank you, Jamie. So as a member of this interdepartmental committee, our work really does not stop here. And we've already began to identify from our respective departments ideas, partnerships, and strategies to address some of these recommendations, all with the shared vision of making Norfolk County a great place to ride your bike. And our hope is to continue to work collaboratively toward improving the cycling infrastructure and culture and strive towards achieving that higher award standing. Let's go for platinum. And we ask that you take this report and presentation as information, and we invite you to join us on our continued pursuit of making it Norfolk County a bicycle-friendly community. Thank you very much.
Thank you. I have a motion moved by Councillor Columbus Board Member Columbus and seconded by Board Member Rabbits that staff report HSS 19-20 bicycle friendly community designation be received as information. All those in favor? And that's carried. Councillor Columbus.
I understand we are doing a certificate presentation?
We are.
Okay.
Madam Chair, can
Yes,
we
sir.
ask questions of the deputation?
Sure.
Yeah. Just wonder, what criteria do you have to achieve to become platinum, or one of the best, I guess? What's the criteria?
That's really excellent feedback. So one of the pieces that we really look at is the number of people who are choosing to cycle in your community. So many communities that have a platinum designation would have around 5% at least of their population choosing to cycle almost on a daily basis. You would also have a really connected network. Roadways, be it bicycle lanes, paved shoulders, separated trails that can very easily get people to schools, to libraries, and to major destinations. So the on-street infrastructure and getting people out on their bikes is a really key piece of being platinum. But the other piece is running things like Bike to Work Month events, Bike to School Day events. There are some provincial initiatives that take place in May and June that can really help you get to platinum. Working with the business community to make sure that there are bike racks at destinations and that businesses are promoting cycling and that there are events and that the community is really supporting things like Tour de Norfolk. And I would mention that most communities that are platinum do have staff that are dedicated specifically to cycling and walking initiatives in the community. So some really concrete things that could be done to achieve that platinum piece.
Excellent. Thank you, Jamie. Councillor Huffman.
Thank you, Mayor Chop. I just wanted to add, this past week, from Thursday to Sunday, at the Old Town Hall in Waterford, there was a production put on by a Toronto artist, Evelyn Perry, and it was called Spin. And it was the history of the bicycle, and it was the history of the empowerment. It brought in the empowerment to women and the bicycle, but it also, one of the quotes in the production was that over 100 years ago when the bikes, because it was the first personal transportation mode, that doctors prescribed bike riding back then for health and wellness. And yeah, so we've got a little bit to catch up on. But it was well received in the community, and it just kind of tied in very nicely, and they had a beautiful red bike out front, and it was a great production. So ride your bikes.
That sounds wonderful, and I'm not surprised to hear that it was well received in the community. Riding a bike can be very fun, in addition to being a very healthy and active thing to do.
Thank you. So we'll do the presentation now then? Is that?
Yes, let's do that.
Okay. I just wanted to take a couple of minutes just to talk about one of our honored members of staff. First of all, we are so pleased to accept the Bronze Level Bike Friendly Community Designation Award on behalf of Norfolk County. And we would also like to take a few moments to recognize the honor of the work of Michelle Crowley, one of our health promoters with the Haldeman Norfolk Health Unit, and the lead person who completed and submitted our application for this award. This was a project that she was very dedicated to and excited about. Unfortunately, after facing a cancer diagnosis, with bravery and dignity for over 4 years, Michelle passed away at the end of February. Her passing has been a great loss for the Health and Social Services Division. Michelle was one of the first health promoters hired by Haldeman Norfolk Health Unit 19 years ago. She specialized in the areas of promoting physical activity and active transportation. She was passionate about physical activity and active transportation and lived this passion every day of her life. She was an avid runner and cyclist. In fact, her love of cycling is how she met her husband, Rob. She loved trail walking and hiking with her dog, Norm. Michelle's work at the Haldeman Norfolk Health Unit has greatly contributed to the promotion of active transportation in our community. She brought the Share the Road campaign to Haldeman and Norfolk. She was one of the original members of the Norfolk County Built Environment Working Group, building strong relationships with our municipal colleagues in planning, public works, and community services, and advocating for sidewalks, bike lanes, and road shoulders that would be safe for walkers, runners, and cyclists. She worked with other county departments and community groups to promote trail development and organized bike rodeos for people with disabilities to ensure that their bicycles were safe to ride and that they had access to and knew how to properly wear bike helmets. One of her greatest local accomplishments was her work with Pathways for People, our active transportation citizen advocacy group. Also known as P4P, Pathways for People celebrated its 10th anniversary in 2018. Throughout the past decade, they have organized and led a number of awareness and advocacy campaigns and community events. Michelle was incredibly proud to work with such a dedicated group of community volunteers and loved every minute of the time she spent with Pathways for People. I'm glad that their work continues. We are sad that Michelle is not here to accept this award, but we know that she would be thrilled that our community has been recognized in this way. Thank you again to the Share the Road Cycling Coalition for this honor. And thank you to Michelle. It's a tough thing to move on from that presentation now, but some good news, some other good news. The graduates of the Ideas Advanced Learning Program also have a report to present today, and that will be followed as well by a presentation.
Thank you, Madam Mayor. In 2017, the Health Unit introduced Foundations in Quality Improvement for all public health staff. Staff participated in training programs and then hands-on exercises to apply their new tools and methodology in quality improvement. Since then, we have supported a cohort of participants, 4 of our staff, in the Ideas Advanced Learning Program. It is a 5-month program with 7 in-class days comprised of a broad spectrum of topics that have been developed to assist healthcare professionals who are leading quality improvement projects and change management initiatives. The purpose of the advanced curriculum is to provide the requisite knowledge base and tools that will enable participants to conduct high-impact clinical improvement projects, manage and integrate non-clinical processes, and lead quality improvement and change management initiatives. Leaders are evaluated based on oral presentation, a poster presentation, and a demonstrated progress of the project that they undertook. Today, I am proud to congratulate our graduates from the Health Unit on the Ideas Advanced Learning Program. So if I may at this time ask Mayor Chop to come forward and present the awards, and Councillor Huffman as our representative from the Advisory Committee.
I'll let you.
Thank you, Madam Mayor. I'd like to have Mr. Okaranka present the next report on the CQI, and he'll present the report and then answer any questions that the board may have this afternoon.
Good afternoon, and through the chair. It's my pleasure to meet with you this afternoon and humbly request that the board receives staff report HSS 19-17, how the Norfolk Health Unit continuous quality improvement, and endorse the plan and activities being implemented to institutionalize a continuous quality improvement culture within the health unit. The OPHS mandates that the Board of Health ensure that a culture of continuous quality improvement underpins the programs and services delivered by the health unit. In response to this mandate, the health unit launched the Healthy Public Health Creating a Quality Culture Together initiative in April 2017. This report provides an overview to the board on the steps staff have taken thus far and intend to take to institute and strengthen the CQI culture within the health unit. The journey thus far. As of December 2018, over 96% of staff have been trained in the foundations of quality improvement. This training was delivered by improving and driving excellence across sectors, otherwise known as IDEAS team from Health Quality Ontario. This training introduced staff to the methods and tools of quality improvement. As a follow-up to the training, staff participated in different work groups to work on identified issues using the methods and tools they just learned. This provided a critical hands-on experience. As of December 2018, the health unit had undergone 4 waves of QI projects with approximately 10 projects per wave, and over 96% of staff were participating in these projects. On the current wave, the QI projects are now team-based, thus increasing the relevance to the everyday work of staff. Identified QI projects are now embedded in our annual operational plans for all the teams. To further increase the QI capacity within the health unit, as we just observed, 4 members of staff participated in the Advanced Learning Program and graduated on February 15, 2019. Now, what are our next steps? We would continue to identify and implement QI projects within the teams. New staff, as they join, will receive training on the foundations of quality improvement. We will also continue to rotate staff through our steering committee. Our steering committee manages the QI initiative, the health unit-wide QI initiative. So we'll continue to rotate staff through that committee, thereby strengthening our capacity within the health unit. We also continue to explore new ways to increase QI capacity within the health unit, e.g. advocating for participation in another round of advanced learning program. In conclusion, as staff continue to institute CQI culture, staff will continue to seek the board's support and guidance. With that, I'm happy to answer any questions members of the board may have. Before we go, I'm sure you've received a copy of a poster which is titled Connecting with Elementary Schools. This is an example of one of the QI projects we've implemented. The aim of this project was to improve the response rate of initial principal contact. And the result demonstrates that there was up to 74% increase in percentage points at the end of the project. So we had initial at baseline, Haldeman, about 24% response rate. At the end of the project, we achieved 100% response rate. With that, once again, I'll be happy to answer any questions the board may have regarding our initiative. Thank you for your time.
Okay, I have a motion that has been moved by Councillor Martin, or Board Member Martin, and seconded by Board Member Columbus that staff report HSS 19-17, Haldeman Norfolk Health Unit Continuous Quality Improvement be received as information, and that the Board of Health endorse the plan and activities being implemented to institutionalize a continuous quality improvement culture within the Haldeman Norfolk Health Unit. Board Member Van Passen.
Thank you, Madam Chair. Could somebody explain to me the difference in terminology between a provincially mandated program and now we want to institutionalize that program?
Through the chair to the board member. So the work we do in the health unit is guided by the Ontario Public Health Standards. So it does set the requirements we need to meet. That's the expectation. So what has happened is that there have been some requirements where we have been lacking, and one of those requirements would be on having a continuous quality improvement culture. So we are on the path to getting to where we will say we are meeting that requirement. So as it is now, we are not meeting that requirement. We are working towards ensuring that that requirement is met, and that's what this journey is all about. I hope I've been able to answer the member's question.
Board Member Van Passen.
Well, I think I got it, that the province mandates that you have to do it, and you want the whole team on board to be willing to do it. Is that what I'm getting?
Truly, Chair, sorry, I didn't get that. The last part of your question, sorry.
What institutionalizing it means is that you want to get all the employees working together to get there. Is that wording? Okay.
Truly, Chair, that would be correct. It's to get all the members of the team working towards that. That would be, I guess it's my English, that would be what institutionalizing would mean.
All right. Thank you.
Any further questions? Great. Again, the motion to receive the deputation as information moved by Councillor Martin and seconded by Board Member Columbus. All those in favor? And that's carried. Next is Staff Report HSS 19-16, and that's in regards to the social detriments of health and health equity.
Thank you for allowing us to be here today, Madam Chair and councillors. This is Allison Dunn, and I am Margot Fournier. We're better known as the Social Determinants of Health public health nurses. Health is more than just a state of not having illness. The World Health Organization states that there are many things that encompass what makes us healthy. As you can see, this is an iceberg. Health is only the tip of the iceberg that we can see before us. Underneath of the iceberg, there are many things that will impact a person's ability to achieve health. These are called the social determinants of health.
And as you can see before you, this is a list that Mikkonen and Raphael put together of the social determinants of health in their book, The Social Determinants of Health, The Canadian Facts. These factors, often described as the causes of the cause, have an enormous impact on an individual's health status. In fact, in 2013, the Canadian Medical Association put together a report outlining what factors actually do make Canadians sick. And as you can see, 50% of what contributes to ill health are those same determinants of health that we saw listed earlier. Things such as income, education, a sense of belonging, and a social safety net. So in order to illustrate this, we have developed two stories. And although the stories are fictitious, they're not far from the truth. These images and names don't represent any true people in our county. So this is Maria. She's a 55-year-old woman who moved to our county 2 years ago, and she's now working on a local farm to support herself and supplement her family's income. Since arriving, she's gained quite a bit of weight, has begun smoking again, and last year she developed type 2 diabetes, which is not well controlled. Maria's managed to find a doctor, but she's been finding that her doctor's appointments are a source of stress. She's having to take time off work to see her doctor, and she worries because she can't afford the loss of pay. She also worries because she's a new employee and she doesn't want to lose her job. She doesn't have any benefits at work that allows her to take time off for medical appointments. Maria lives in a rural area of the county, so without consistent bus service, she must rely on her family members for transportation, and she also needs their help with translation. One day, Maria receives a letter in the mail for a breast screening mammography clinic. She wonders if the clinic's open later in the evenings. She's heard the messages about diet, smoking, cancer, and wonders what her chances of having breast cancer might actually be. Then Maria simply throws the letter out. She's taken enough time off of work because of her diabetes, and she doesn't want to impose on her family anymore.
Now let's meet Donna. Donna is also a 55-year-old woman. She grew up in the county. Lucky for Donna, her parents realized the importance of education and was financially stable to allow her to receive a Bachelor of Science in Nursing. She now works in the county as a registered nurse. About a year ago, Donna was also diagnosed with diabetes. However, Donna's story is a little different because Donna received support from her family, friends, and physician and was able to quit smoking. Donna also was able to modify her diet and increase her exercise, and now her diabetes is much better controlled. She receives a similar letter in the mail from the breast screening mammography clinic. She does not hesitate. She picks up the phone, calls, and books an appointment. The next day when she arrives at work, she asks for the time off, submits the paperwork with pay so that she can attend that appointment and achieve improved health. This is called the health gradient. Before us, we all have a health journey. The ball that individual is pushing up the hill is called a health hazard. And the higher the hill, the harder it is to push that ball. So can you imagine living in poverty, poor housing, being unemployed, and being food insecure and trying to achieve health? That is going to be very, very difficult. Health equity is considered a mandated foundational standard of the Ontario Public Health Standards. And we at the Health Unit are doing a lot of things to ensure that we are following this standard. All staff are required to complete a free online program around health equity impact assessment tools. We are increasing the staff's capacity by offering training on the health equity, the social determinants of health, colonization, and anti-oppressive work. As well, we have a planning template, and it includes health equity so that all staff are looking with a health equity lens. And finally, we are developing a template that staff will use when developing Board of Health reports.
So respectfully, we would recommend that this report be received as information, that the Board of Health endorse the activities that are currently being implemented to reduce health inequities within our community, and that the Board of Health be open to us coming back again to update you on the social determinants of health and health equity. Thank you.
Thank you very much. Any questions from councillors? Okay, thank you very much. So I have a motion that's moving that recommendation by Board Member Martin and seconded by Board Member Columbus. All those in favor? And that's carried. Next, we have Staff Report HSS 19-21, which is the Vector-Borne Disease Program update. If staff could please present their report.
This is regarding report 19-21, an update on our vector-borne disease program for the health unit. I'm just waiting for the slides to show up here. We did have some significant activity with vector-borne disease in our area. I'll start by giving you a brief overview. Program does involve three components: surveillance, so there's tick dragging, that we do for active tick surveillance, and we do mosquito surveillance for West Nile virus and Eastern equine encephalitis. We also do case management and, of course, our educational and awareness piece. Just so you know, if you're wondering what the white guy in the suit is, that is our active tick dragging. It's also a good weight loss clinic too. Big results for our active tick surveillance. This was our first year doing active tick surveillance. Prior to 2018, we did passive surveillance where the public could bring in ticks and we get results that way. Our role with tick surveillance is identifying how much ticks are spreading and Lyme disease prevalence. Moving to active surveillance, we did 16 sites in 2018, 8 in Haldeman, 8 in Norfolk, and as a result, we found 6 new risk areas. So this is on top of Long Point area and Turkey Point area that were already identified as endemic areas. So you can see on the map all the new areas identified. It does include Dunnville now. Moving forward, we're going to look at 3 more sites in 2019 this year to do some active tick surveillance. Again, 2 in Haldeman. We're going to try 1 in Norfolk just because we did find ticks there in the spring, but not again in the fall. We're hoping maybe that will push the border out a little east into Haldeman. And then obviously with these results comes a lot of public information, a lot of public messaging, big promotional campaign, notifying healthcare providers, the public, media releases, social media. We'll be doing a lot of that this year. We are also targeting schools to work with them to handle ticks that kids come across at school. Moving to West Nile on eastern equine activity, we did have significant year there as well, unfortunately. We did find 5 of 59 mosquito pools tested positive for West Nile, 1 in Simcoe, 1 in Caledonia, 1 in Dunnville, and twice in Cayuga. We also found a lot of eastern equine activity in horses again. This is a virus that pops up intermittently through the province. And we had 4 horses in Haldeman test positive for eastern equine. Fortunately, no positive human cases or mosquitoes in 2018 for eastern equine. There's only been 1 case in the province for eastern equine, which was in 2016, and it wasn't from our area. Now, based on these results, you do see on the graph 2012 was a bad year as well, but the year prior and the years after, not a lot of activity. So keeping with that in mind, we do have to look at 2012. Is this the start of an increasing trend, or is it an outlier kind of situation? So we will do heightened promotion on West Nile virus this year and eastern equine, but we do want to see if this is, again, start of an increasing trend. And that is a very quick and brief overview. Any questions?
Thank you. Any questions from councilors? Councilor Huffman, Board Member Huffman.
Thank you, Chair. Okay, so first off, my question, so you don't know why 2012 was such a high year? It's just
a lot
kind
of times it will be weather dependent. If you have a hot, wet summer, more mosquitoes. The earlier the hot and the wet is, the more mosquitoes breed, the more mosquitoes there are, more chances of being infected by an infected mosquito. So.
Okay. And now in regards to the ticks, I mean, hearing lots from a lot of people in the community where they're just out in their backyard and finding that they have a tick on them. So
Yep.
it does, some of it, I don't know if it's because there is more media, coming out about them and people are more aware.
Yep.
But I guess in regards to that, so do we have a number of reports in terms of people who have contracted Lyme disease?
The cases this year were down. We only have 3 cases this year reported to us. Last year was 7.
Okay.
That is staying with the provincial trend too. The case rates were down provincially as well. Okay. 2015, things changed. The case definition of Lyme always depended on laboratory testing. 2015, they introduced clinical diagnosis. If you have the rash and you've been to one of those risk areas, you can be a case. So we saw a steady increase in cases that way, possibly. This also could be awareness, people getting tested, but now we're back down again. So could be weather, could be a lot of things.
Okay, my next question, this might be out of your realm of what you want to answer, but I'll do it anyways. Historically, because Lyme disease is really a fairly new type of thing, there's been individuals who have struggled with, I guess, the healthcare system in Ontario with, a diagnosis, but I think things are moving along that way. Are there still issues in terms of individuals with Lyme disease obtaining the proper health care?
I cannot speak for them.
Okay.
I've heard from them and they have said they are having problems, yes.
It's still a struggle? Okay.
It's the testing itself has accuracy issues for blood testing, and there's only so much physicians can do for treatment. It is a hard disease to diagnose as well. Like a lot of the early symptoms are very much like the flu, same with West Nile.
Yeah, a lot of them mimic other diseases. So.
But our tick positivity rates are pretty high, over 20% usually on most years. So raising awareness amongst physicians is key for us too.
Okay, all right, thank you.
Board Member Columbus.
Is the incidence of more Phragmites growing in the south along the lake shore, is that the breeding ground for ticks? You know,
Typically, you won't find ticks on a beach. They want some moisture. Deer ticks in particular, they want the forest. They want the shade. They want hot and moist. They want leaf litter in the bush. I've done this program for 10 years and haven't received one tick that was on a beach.
so what about Phragmites, the invasive species?
It would be hard to tell if it's there. I would not think so much that it is there. I would think up, if you're thinking about Turkey Point area, usually the submissions we're getting are from up on the hill.
Thank you.
Past that.
I think, Councillor Columbus, to your point, I've heard a lot of people that live down there on Turkey Point because it's just it's a shallow, kind of marshy area where the Phragmites are growing down there. So
Yep.
I think that there has been a high prevalence, actually. Any further questions? No, okay. I have a motion moved by Board Member Ravitz and seconded by Board Member Van Passen that staff report HSS 19-21 Vector-Borne Disease Program Update be received as information, and that the Board of Health support the Haldeman Norfolk Health Unit's vector-borne program activities, which includes active surveillance and education regarding prevention strategies for vector-borne diseases. All those in favor? That's carried. Thank you very much. And our last presentation is staff report HSS 19-22 regarding the Haldeman Norfolk Health Unit Harm Reduction Program update.
Good afternoon, board members. This is my colleague Tamara Robb, and I'm Lauren Martin, and we thank you for having us here this afternoon to provide you an update on our harm reduction program. For your reference, last program update was provided May 2017, and previously we provided a presentation September 2017 on the harm reduction program enhancement by the Ministry of Health and Long-Term Care, and an update was provided in March 2018 in regards to one-time and base funding that was received for our needle syringe program and resulted in the needle kiosks that you see around the community. So to provide you some context, in Canada and internationally, the 4 pillars approach is used as a comprehensive strategy to address drugs and substance use. The 4 pillars include prevention, treatment, harm reduction, and enforcement. We fall under the harm reduction pillar. Part of our mandate is to support measures that reduce the negative consequences of drug and substance use. The Ministry of Health and Long-Term Care define harm reduction as policies, programs, and practices that primarily aim to reduce adverse health, social, and economic consequences of the use of legal and illegal drugs without necessarily reducing substance consumption. Harm reduction interventions respect the rights of individuals to use substances while increasing awareness regarding lower risk use and address the risk and protective factors related to harms. I'd like to provide you with an update on the burden of opiate use in the 2 counties, Haldeman and Norfolk. And so in terms of outcomes, we look at emergency department visits, hospitalizations, and deaths. So if you turn your attention to the table, we have compared Haldeman and Norfolk with Ontario. From 2013 to 2017, the rate of opiate-related emergency departments and visits in Haldeman and Norfolk have been consistently higher than the provincial average rate. Opiate-related hospitalizations in Haldeman and Norfolk for 2017 was 25.1 compared to 15.1 for Ontario. Preliminary data for the first 9 months of 2018 show Haldeman Norfolk is still higher than the province with 15.3 per 100,000 people versus 10.8 per 100,000 people for Ontario. In terms of opiate-related deaths in Haldeman Norfolk, in 2017, our county rate was 9 per 100,000 versus the provincial rate of 8.9. In 2018, there was 4 deaths in the first 6 months of 2018 in Haldeman, Norfolk. Preliminary data for 2018 indicates a similar rate for 2018. There was 4 deaths in the first 6 months, and 2 more were confirmed July to September. We don't have any data yet for October to December. For 2019, the health unit has received indications that there's been 5 opiate-related deaths in the first 3 months of 2019, 3 deaths which occurred in Norfolk, and all of them of which occurred in March, and 2 deaths which occurred in Haldeman since February.
So I'm going to cover some of the harm reduction programs that we have at the health unit, and the programs that we do offer are fall under the harm reduction guideline that we're mandated to follow through the Ontario Public Health Standards. So we do have a needle syringe program, which we have presented some information on this in the past to the board. We continue to have a very growing and expanding needle syringe program. And last year we gave out just over around 88,000 needles and syringes, which averages to about 235 a day. So we do partner with different agencies in the community to help distribute those supplies. At the end of 2017, we started with our naloxone distribution program. So naloxone is a medication that temporarily reverses an opioid-related overdose. So we're able to provide kits to members of the community and individuals themselves who are using these substances to hopefully prevent some deaths. We also have our sharps disposal program. So we do provide sharps containers to individuals who access our needle syringe program, but we also installed sharps kiosks throughout the community, which you're aware we have one just outside here. So we have 5 set up in Norfolk, 4 in Haldeman, so they're 24/7 accessible, and we've had great success since we installed those last year. From April to December of 2018, we received over 15,500 needles and syringes returned through the kiosks, which has actually increased our return rate by over 10%. We do have to report to the ministry our needles in and our needles out, so it's good to see that our needle return rate has increased. And those numbers are just what's reported or returned through the health unit and the kiosks. So if people return syringes in sharps containers to the pharmacies and stuff, we don't have access to that data. Another piece of our programming is our harm reduction action team. So this is a group that started in February of 2017 that involves representatives from the health unit and social services, but as well as many other community agencies, including OPP and EMS, Children's Aid, REACH, Probation and Parole, etc. So we do meet monthly to plan and address some harm reduction strategies within our community, and we do offer community information events, which we did do in 2017. So we continue to meet monthly to build partnerships and share information to really try to get an idea as to what is happening within our community. So then early last year, we received additional funding for the harm reduction program enhancement. So this again is mandated to public health units, and there's 3 components within this program enhancement. So we have to develop an early warning system. So what that means is we have to develop criteria and look at the data in our community to see what kind of our baseline is, and when we see an increase in, say, opioid-related deaths or ED visits, et cetera, and then how we're going to address that. And that will lead into a development of an overdose response plan. And the other piece in the harm reduction program enhancement is our naloxone distribution for community-based agencies. So we're mandated by the ministry to work with certain eligible community-based agencies to train their staff to be able to distribute naloxone. So it'll be increasing that access to where people can get naloxone kits. So currently they can receive them from the health unit or a pharmacy, but once we get this program launched, then they'll be able to access them at other points in the community as well. And that is it.
Perfect timing. Any questions from board members? Board Member Van Passen?
Madam Chair, I've heard a theory about naloxone that it actually makes things worse because people believe now they can take any illicit drugs because there's something out there to save them. So they don't care anymore because we have this miracle that can save them. Do you have any comments on that?
Have heard that comment before. What we're finding is that nowadays you don't know what is in the drug. So naloxone is intended to respond to opioid-related overdoses, but what people are finding is that if they're maybe using
cocaine, that there is fentanyl laced in that and they don't even know. So people are having the naloxone kits around when they're using, or at least that's what we're trying to get them to do, because they don't even know what they're using anymore. So yeah, you may have some instances where people may be playing a little bit more Russian roulette and want to kind of chance and see if they can take more and know that the naloxone's there, but the majority of people that we see, that is not the case. They're having it there as a life-saving measure because they don't know what is in the substance that they're using. Go ahead.
I would just add that addiction is a complicated issue, similarly to any mental health condition. And so at least with naloxone, we're giving people the opportunity to one day hopefully enter treatment and rehab, but our mandate is harm reduction and preventing those deaths that are occurring.
I see a couple other hands up. I just want to remind you guys, it's just 3 o'clock right now, and we do need to kind of have a hard stop here. So if it's a short question, otherwise we could come back to this at the next Board of Health meeting.
Short one.
Okay.
With respect to opioid overdoses, do you know what the percentage is of suicide versus accidental overdose?
I believe there is data on that from Public Health Ontario. I don't have that information with me today, but that is something that we could likely provide to you.
The majority of them are unintentional, though.
Board Member Huffman?
Thank you, Chair. Very quickly, just wanted to say that I know a lot of this, I don't know, the treatment plans, et cetera. Let me just start over. I just want to say, there's so much stigma attached to this, and there's so much stigma attached to addiction. And, you know, in the community, just kind of, you know, speaking with people and hearing comments, there's a lack of information. I think the information, sorry, I apologize, the information is there. There's a lack of informed comments regarding this. And like you said, addiction is a very complex issue. And I think that when we talk about, you know, it being a miracle drug, you know, with naloxone, I think those are exceptions to the rule. And I just want to say that I am proudly trained to administer naloxone, and I have a kit in my house, and I do carry it with me if necessary. So thank you for the work that you do, and it's much appreciated in our community.
Thank you.
Thank you for your presentation.
Thank you. I'm going to leave up with Stephanie. We have some updated stats just as a quick review, and also our flyer that has where all of our Sharps kiosks are located in case you ever have any questions about where they are.
Perfect. Thank you.
Thank you very much.
Okay, so I have a motion moved by Board Member Michele and seconded by Board Member Martin that staff report HSS 19-22 Haldeman Norfolk Health Unit Harm Reduction Program updates be received as information, and that the Board of Health continue to support evidence-informed harm reduction strategies for Haldeman and Norfolk counties. All those in favor? And that's carried unanimously. And next is a motion that's been moved by Board Member Columbus and seconded by Board Member Rabbits that communication item A be received as information. All those in favor? And that's carried. Anything in other business, Arlene? Shanker? No? Okay. In that case, a bylaw 2019-05-BH being a bylaw to confirm the proceedings of the Haldeman Norfolk Health Unit at this meeting held on the 7th day of May 2019 be passed, signed by the Mayor and Deputy County Clerk, and affixed with the corporate seal. That was moved by Board Member Michele, seconded by Board Member Martin. All those in favor? And that's carried. And finally, that the Board of Health meeting be adjourned at 3:05 p.m., moved by Board Member Rabbits and seconded by Board Member Van Passen. All those in favor? And meeting's adjourned. Thank you.
Where is everybody? Where did they disappear to? 1, 2, 3. I think I'm getting a cataract in my left eye. I cleaned my glasses 3 times, and it's still foggy. Yeah, I cleaned my glasses 3 times, and it's still foggy. How do you know if you got cataracts?
Before we jump to cataracts, I'd recommend.
If everyone could please take your seats, we are past the hour 3. Good day, everyone, and welcome to the Norfolk County Council and Committee meeting for this day, May 7th, 2019. I'd like to remind everyone that our meetings are web-streamed and televised. And for those in attendance, if you could ensure that your communication devices are silenced. Are there any declarations of pecuniary interest? None noted, Madam Clerk. There is one proposed change for today's agenda, and that is removal of closed session item 11.b. It's a verbal update by the county solicitor regarding legal advice from April 2nd, 2019 council and committee meeting. Are there any other proposed changes to the agenda? Yes.
I was wondering if we could discuss 3F, pull that out of consent, discuss it.
I think we're going to get there.
Okay.
But is that where we do it now? No. Okay, not yet quite. You're getting quicker. So are there any other proposed changes to the agenda? None noted. Can I have a mover and a seconder to approve the agenda as amended? Councillor Taylor and Councillor Rabbits. Those in favor? That's carried. Thank you. We'll now move to consent items. This is 3A through to 3G. And if any member of the committee wishes to discuss a consent item or ask questions of that item, please identify so now, and we will move to have it listed as an item under staff reports. And I'll start with Councillor Taylor.
Thank you, Chair Columbus. 3F, affordable housing opportunities in Haldeman, Norfolk.
3F. Okay, where are we going to put that, Madam Clerk?
That will go under 7. It'll be 7A.
That'll be 7A. Okay. Just give me a second here to organize myself. So that's... And then I saw Councillor Michelli.
Thank you, Mr. Chair. I would like to have consent item 3A pulled for discussion. 3B.
3A, 3B.
And 3E is an echo.
Okay. Okay, and Mayor Chop.
Thank you, Mr. Chair. I think we could have made that easy, actually. Then I believe it's going to be all A through G pulled.
All of them? Okay. Well, that'll be easier. Thank you. Okay. Do I need to move in a second here? Okay, so those items will be coming fully under reports. We'll move to communications at this time. Our first communication which is the Integrity Commissioner report respecting the Code of Conduct complaint. This report is before you, and Mr. Mascarin is here to respond to any questions of this committee. Please note that we have the OPP here for presentation report commencing at 3:30 also. And can I have no. We're going to hear from the Integrity Commissioner, Mr. Mascarin. If you take the podium, that'd be great.
It's unfortunate that we get to meet like this. The first time I generally show up in front of a council or a committee is to introduce myself, do some training, some education. That's forthcoming. I'm sorry I've had to appear before you today on an investigation. In fact, two. They're combined, single matter dealing with pretty much the same incident. I trust that you've all had an opportunity to read the report. The report, in my view, speaks for itself. It was put together in accordance with your complaint protocol, in accordance with the procedural requirements for an investigation, which I personally undertook, and it's detailed in the reports. Just very briefly, I'm not going to speak to any great length on it, but the complaints dealt with two separate matters, both filed on January the 21st. Two separate individuals filed it. Both alleged that Mayor Chop had committed a number of contraventions, not only of the Code of Conduct, but also of other ethical policies and the procedural bylaw. The allegations stem from an incident that occurred at your meeting, coincidentally the same one that you appointed me as Integrity Commissioner, dealing with a matter at the meeting where the mayor was alleged to have made some certain statements and have taken certain actions that the complainants felt breached the Code of Conduct and other matters. The mayor was offered an opportunity to respond to the allegations. She and her legal counsel provided me with materials. I also personally met with the mayor sometime in the middle of March. We spoke, I think, for about an hour and 15 minutes. The materials that I reviewed in order to conduct the investigation are set out on page 3 of the report, and the details of the alleged contravention and the proposed contravention of certain policies are set out on page 5 of the report. The pertinent details of the meeting and the incident are set out in some detail on page 6 of the report. The county records its meetings, and the primary evidence that I used was to look at the audiovisual recording of the meeting, and I could tell exactly what happened. I didn't have to rely on other people telling me what happened at the meeting. My findings are set out on pages 7 and 8 of the report. In summary, the incident that I think brought to light the whole complaint was the ripping up of the planning report at an open public meeting by Mayor Chop. She doesn't deny that she did this. She readily admitted it. She advised that she did so deliberately and intentionally. In my view, that removed any notion of an inadvertent error, something that occurred in the heat of the moment. She advised me that she, quote, wanted to make a splash. She indicated that she would never use that term, but that's the term that I actually wrote down in our meeting. I should say mission accomplished. She did make a splash. It was picked up by all the media outlets. Everyone knew about the ripping of the report. The mayor quite candidly said to me, one incident does not constitute a break in decorum. With all due respect, I disagree, and I've said so in my report, for the reasons set out in the report. My findings are summarized in the middle of page 8. There's a breach of sections 5.5 and 8.1 of the Code of Conduct. In my view, the mayor did not conduct herself with decorum at the meeting, and she failed in her duty to treat members of staff with respect and dignity. There was a breach of section 13.1b of the procedural bylaw. The mayor's action in ripping apart the report was, in my view, wholly inappropriate. And in the council staff relationship policy, which is supposed to set the framework for a conducive relationship between staff and council, there was a breach of sections 5.4.1, 5.4.2, and 7.2 of the council staff relationship policy. In my view, the mayor's actions created an environment that was not dignified nor respectful of staff and failed to show respect for the professional capacities of staff. My conclusions, the actions of the mayor, both in her words and tone at the meeting and her ripping up of the planning report, were deliberate and intentional. She stated so herself, and were done to make a point. She made the point. That doesn't mean that the actions were uncivil or inappropriate. They were both of those in my view. Let me say that they were inappropriate for any member of council to do, but more so because they were done by the mayor, the head of council. Quite honestly, I would have expected a bit more. There was no proper justifications for the actions of the mayor. She took a lot of time to tell me that there was. I did not agree, and I've said so in my report. So, in preparing my report, I've taken into consideration that the topic of backyard chickens was not new to the municipality, but let me say it was new to most of these members of council. There's 7 new members from the last term. It started with, I think, Councillor Columbus indicating this is not a stranger or a strange topic for the council, and that's true if council is a continuing body, but this council hadn't heard it before. We note that the meeting occurred early in the council term. If I'm not mistaken, I think it was the 2nd official meeting. I've taken into consideration that the mayor is a first-time elected representative in public office, and that she did believe, had an honest belief, that she was being stonewalled and blocked by staff. I also note, though, that the planning report was prepared by professional planners who have an obligation to impart independent professional advice and to consider the broader public interest. I note that there was no integrity commissioner at the time for the mayor or members of council to consult with. So, viewed in context and in its totality, my view is that the mayor's actions were inappropriate and in contravention of the code and the other provisions of which I've noted. My recommendation to you is that council should demonstrate its commitment to the code, it's your code, and that you formally reprimand the mayor. She's been reprimanded by me through the report. In addition, and as a remedial measure, I believe it's important for the mayor to acknowledge the contravention, to indicate that she won't do it again, and to formally apologize. And my report sets out a date of May the 31st. Mr. Chair, members of committee, that's my presentation, so to speak. I'd be pleased to answer any questions that go to the penalty, that go to the recommendation. Let me say before we start, and I usually say this in the education and training session, this is not an opportunity for you to cross-examine me. Council is sitting as an adjudicative body. I have made my decision, and the report, as I said, speaks for itself. I have delegated authority to impose the penalty. Thank you, Mr. Chair.
Thank you, Mr. Mascarin. I will go to questions from committee. Councillor Taylor.
Thank you, Chair Columbus. Would you please go into a little bit more detail about what Section 18.1A is, what the reprimand would consist of, or anything like that?
The reprimand, through you, Mr. Chair, to Councillor Taylor, a reprimand is a rebuke. It's an expression of disapproval. You can word it how you'd like. I would suggest that it's an admonition as to the conduct of the mayor and a request that she adhere to the dictates of the Code of Conduct and the other ethical policies of the municipality.
Councillor Taylor, I did ask that question of the clerk earlier, just to clarify that, and I will read it because we didn't get a copy of it, but it's 18.1. Where under the Integrity Commissioner bylaw, the Integrity Commissioner decides that a member has contravened the Councillor Code of Conduct, the Integrity Commissioner may, under Section 13 of the bylaw, reprimand the member of council, B, suspend the remuneration paid to the member in respect of the member's services for a period of up to 90 days, and C, propose another equitable remedy such as requiring a council member to issue an apology. That's 18.1. Other questions to the Integrity Commissioner? Councillor Michelli.
Thank you, Mr. Chair. Mr. Mascarin, thank you very much for your presentation. I'm just curious, you have made a recommendation that the mayor make a public apology. So does that imply then that there is choice involved in that?
Through you, Mr. Chair, to Councillor Michelli, no, there really isn't. 18.1 says that I can impose it. My recommendation is that council back me up on that and show their commitment to the integrity of the documents that you've put in place for the ethical conduct of yourselves as well as the head of council.
Thank you.
Further questions? No further questions. Mayor Chop?
I'm just wondering, Mr. Mascarin, is there a rule that demands that if one councillor asks for a piece of information, that information go to all members of council? Do you know of any such rule under the Municipal Act?
Through you, Mr. Chair, to Mayor Chop, I've seen that in some procedural bylaws. I've also seen it in, I think it's a council staff relationship policy. I don't know if you have it in any of your documents, and I'm not aware of it in the Municipal Act.
Okay. You have seen our procedural rules?
I looked at it to a certain extent, but I don't know if it's in there.
Okay, thank you.
Thank you. Anything further?
Oh, sorry,
Yes.
one more question, Mr. Chair. Pardon me. To my knowledge, I am permitted to make a statement after the end of your presentation today. Is that correct? I believe that's what you had told me in my office, was that I did get a chance now under the new rules to be able to speak.
Yes, through you, Mr. Chair, to Mayor Chop. There was a revision to the act that would allow a member of council or a member to make a statement, to speak on their behalf in front of council. That was a change. You may have recalled the Magner and Ford case in Toronto. There was a lot of criticism that Mayor Ford stood up and defended himself, and a lot of administrative lawyers would say, but a person should be allowed to do that. The act was changed and now does permit a member of council to speak. What it says is, in fact, to be fair to you, Mayor Chop, there is no monetary penalty imposed, so there wouldn't be a pecuniary interest, so you'd be entitled to speak in any event, I think. So yes, you would be entitled.
Thank you, sir.
Okay. Did you wish to speak now, Mayor Chop?
I do, but I think it's probably prudent to allow any further questions to Mr. Mascarin.
Are there any further questions? Yes. Councillor Huffman.
Thank you, Chairman Columbus. Mr. Mascarin, so in regards to the opportunity for Mayor Chop to speak, is that then, is there a format to ask questions of her after that, or?
Mr. Chair, to Councillor Hoffman, I'm not sure what your procedural bylaw might allow in that. I would think that the statement would be the statement. I'm not sure that there would be questions of it, but I don't know what your procedural bylaw allows on that.
I'm just going to ask the Deputy Clerk here to make a comment on that. Go ahead, Stephanie.
Through the chair to committee, I would suggest that it would be the mayor making a statement and that it wouldn't be having questions following it.
Okay, thank you very much for that clarification. This is all uncharted territory, so not quite sure what the procedures are.
Are there any other questions to Mr. Mascaron? Okay, I'm going to ask you to be seated for now, and the mayor wanted to make a statement, so we'll hear from her. And
Thank
then
you.
we may have you come back to the podium again. Thank you.
Thank you, Mr. Chair. Firstly, I just wanted to address two items that I just heard, and one was in regards to the sharing of information and this being new to this council. When I began in December, I had asked on numerous occasions for various information, including the reports on the chickens. And I believe councillors will recall, even in one of those first meetings, they had a manila envelope about 4 inches thick with information, and that was duplication of information that I had requested. To confirm this, in an email from another councillor, actually just recently with a member of staff, it was stated from the staff member that my understanding with sharing information is that it would have to be with all of council, so as to not give an advantage of one councillor over another. I can find nowhere in our own policies or under the Municipal Act that this is a requirement. It is a frustration of mine at times, and so to the best of my knowledge, all of council would have received the previous reports on the chickens that I had requested. So we are also clear, this had nothing to do with Mr. Vaughan, which is why I had forewarned him of the events that would unfold at council, and which is why I asked him twice at council who directed him to write this report. On December the 12th, the day after the motion had been made, Mr. Vaughan contacted Councillor Martin to inform her that despite the fact that he remained in council chambers that evening to do a draft of the report as council had requested, the following day he told her that he was instructed from his superiors to write a report against the chickens. After the council meeting, Mr. Vaughan reached out to CUPE to file a complaint, and as a courtesy to Mr. Khumalo, the president of CUPE, I agreed to meet. In my view, if this had been a proper investigation, Mr. Mascaron would have spoken with Mr. Jerry Khumalo, whom I had had a meeting with. Also in attendance was Yakov Sluchenkov, our General Manager of Corporate Services. Mr. Khumalo stated to me that he personally watched the video twice and that he, as the president of CUPE, contrary to Mr. Mascaron's view, did not believe that my statements were directed at Mr. Vaughan, and rather that I was directing my comments to council as a whole. Now for the prepared statement that I have in regards to the complaint that has been submitted and the requested apology. I think that we would all agree that the world of etiquette and decorum looks quite different now than it did 5 years ago, considerably different than it did 20 years ago, and vastly different since Emily Post wrote her definitive guide on manners in 1922. We live in an era where crude language has become to be acceptable in the little theaters frequented by you and I, but also people of a very different generation. There was a time when a woman wouldn't have ever been allowed in these council chambers, let alone stand as the head of council and wear the pants I'm wearing today. A time when a fellow councillor wouldn't dream of bringing little stuffed chickens to line up across the front of the chair's podium in advance of an integrity commissioner's report coming before council against the head of council. And I doubt anyone could have ever imagined a Democratic representative bringing a bucket of Kentucky Fried Chicken to the House Judiciary Committee hearing last week to make fun of the Attorney General of the United States of America and liken him to a chicken. The irony. But the playwriters want to shock and provoke. I have a kooky sense of fashion. My fellow councillor member must have either seen humor in his actions or wanted to make a statement. The Democratic representative wanted to make a point, and so did I. Council voted 8-1 for planning staff to bring back to council proposed regulations, and 2 to provide municipal comparator data. I would like to draw everyone's attention to the following in Mr. Mascaron's report. He states on line 20 of page 5 or page 145 of your agenda, DCS 19-16, that was sort of the report presented to council that day, and I quote, did not contain proposed regulations. He goes on to say that Appendix B did appear to fulfill the direction for municipal comparator data. The issue of chickens has been going on and debated in these council chambers since 2012. 3 previous staff reports that I know of on this subject have all been prepared, 2 of which have been provided to this council. When I made the motion, I didn't want this to drag on any longer than was necessary, and I don't want it to drag on any longer than is necessary now. Norfolk County has been running multi-million-dollar deficits for years now. Our reserves have fallen from $48 million in 2009 to $21 million in 2017. Our road reserves alone are in the hole $20 million. We have bridges that are falling apart. We have a gas well that has been leaking on county property for more than 3 years. In the same council meeting that we directed staff to bring back to council proposed regulations, we also directed staff to investigate options and costing related to the construction for the Road 45 bridge to include a 2-lane Class A and a 1-lane prefabricated structure. What we received subsequently was a 91-page, $12,000 report from an engineering firm, not staff as directed by council. Yesterday, I fielded more than 20 phone calls on top of everything else from constituents asking me about today's staff report, PW 19-24, which was one of the consent items, for a $2.7 million unbudgeted job. And in their words, they asked me whether or not our Public Works Department knew what they were fixing. There is no West Quarter Line in Port Rowan. It is East Quarter Line. Even Section 2.10 of the code, which Mr. Mascarin has determined in his view that I have contravened, said on the Norfolk County website until a month ago that good faith should be understood within the Lambton community. We aren't even in Lambton County. These are all examples of this council's time being expended on things that we shouldn't be dealing with. So when council asked for proposed regulations, and even by Mr. Mascarin's own admission, that is not what we received, I have an issue with it, and I believe that our constituents do too. We have far bigger issues in Norfolk County than chickens to be dealing with. That said, to the taxpayers of Norfolk County, I sincerely apologize that my ripping of a piece of paper, in my rough estimation, cost us all somewhere between $15,000 and $20,000, if not more. Although we have an expansive report, I guess I still live back in an era where a simple mayor chop, "Don't rip the piece of paper again," would have sufficed. Thank you.
Thank you, Mayor Chop. Mr. Mascarin, would you like to come back to the podium in case there's more discussion on this matter? Are there any further questions to Mr. Mascarin? Councillor Van Passen.
Thank you, Mr. Chairman. Just one question. I just heard a public apology from our mayor. Does that fulfill your recommendation, or would you like a formal motion put forward?
Can you repeat that, please, Councillor Van Passen? Your microphone, if you lift it up there. It's not on, sir. Thank you.
I asked the question. We just heard a formal apology from the mayor.
Right.
Will that meet the recommendation from the Integrity Commissioner set out in his report, or does he require a formal motion placed on the books?
Mr. Chair, through you to Councillor Van Passen, an apology has a certain number of requisite components. An acknowledgement of an error or failure, an express regret for the error, and a declaration or an offer to repair and not to further do any transgressions. I did not hear any of those from Mayor Chop. She apologized for something that I didn't ask her to apologize for. I'm sorry. I would have liked to hear, and I would have loved to have been here to tell you that was an apology that I think you should accept. I don't think that was a valid apology at all. I'm not trying to be hard on Mayor Chop. I actually quite like her. We disagree on this. I told her that when I met with her. I said, we have a different view on this. Yes, decorum has changed over the last 20 years. Does that mean we should all be swearing, throwing water at each other, hitting each other in the head with papers at a council meeting? I don't think so. I don't think that's appropriate. That's not what your code says. And I'm just trying to follow what it is that your code, that this council has put in place. Not this composition, perhaps, but this council has put in place. So my view is that, I'm sorry, I don't think that that apology was a true apology.
Thank you. Further questions to Mr. Mosquera? Okay, where do we go from here, folks? Councillor Van Passen?
Thank you, Mr. Chairman. I would like to offer the following motion, that the Integrity Commissioner's report dated the 9th day of April 2019 be received with information, and further that we ask the Mayor recognizes Council's displeasure with her actions on January 8th, 2019, and further that Council asks that the Mayor offer a public apology no later than May 31st, 2019.
Thank you. So we have a motion on the floor, recommendation on the floor. Councillor Huffman, I saw your hand up.
Thank you, Chair Columbus. I'm unsure as to what I'm allowed to say. I don't know. I respectfully disagree with my colleague, Councillor Van Passen, that he heard an apology. I absolutely did not hear an apology from Mayor Chop. Based on the information and feedback that I have from my constituents, they're extremely displeased with the way things are going in terms of the lack of decorum and respect amongst this council. I would still like some further clarification in regards to what the comments were about one staff receiving something and it goes to other staff because our council, because then one councillor has an advantage over others. That happens time and time again with this council. So there's more issues to be resolved. I don't find that the statement made by Mayor Chop was appropriate in any way, shape, or form this evening. We were discussing an incident that occurred at a meeting where papers were ripped up. It was a lack of decorum, it was a lack of integrity, and it was a lack of respect for the staff of Norfolk County. Council and staff need to work together. We are here for 4 years together. So I suggest that we get our stuff together. So respectfully, I did not hear any apology.
Further comments, questions from board, from members? No? Okay. Yes, Councillor Rabbits.
Thank you, Mr. Chair, and through you to Council, I would like to second Councillor Van Passen's motion to accept the report we've received as information. And I didn't hear in Mr. Van Passen, Councillor Van Passen's motion any inclination that the apology had been accepted. He was, in my view, endorsing what was written in the report, quoting what was in the report, and I think that this would be an opportunity for us to accept the report and move forward with the recommendations as they are printed.
Okay. We do have a mover and a seconder for that recommendation. Is there any further questions or discussion? I don't see any. I'm going to, yes, Councillor Michelli.
Thank you, Mr. Chair. I guess this is to you, Mr. Mascarin. You said, sorry, you can't hear me? Okay, is this working? Can everybody hear me? Okay. Mr. Mascarin, I'm asking just this question. Your recommendation is that we will be receiving a true apology from the mayor by the end of this month. I am curious as to know how we will know it's a true apology.
Mr. Chair, through you to Councillor Michelli, I've indicated to you the indicia, the criteria for a true apology. I'm not going to draft it for the mayor, but when you hear an apology that's sincere, that's truthful, that actually speaks to the incident and shows some regret or remorse for the action that may have happened, for the wrong that was done, I think we will understand what that is. I didn't hear that today.
Thank you.
Councillor Rabbits.
Thank you, Mr. Chair, and through you, I would like to call the question, and I do request a recorded vote.
We cannot do a recorded vote. This is committee, Councillor Rabbits.
Very well. I'd like to call the question at least.
Okay. Councillor Martin.
Thank you, Mr. Chair. I think it would be remiss to not take advantage of this opportunity, and though I do agree with Councillor Huffman's comments, we need to come together as a team. We need to work with staff. We need to ensure that we do this moving forward for the best future of Norfolk County. I think it is important to note that Mayor Chop has a certain decorum that she has always had from day one. And this is part and parcel with the support that she has received in the community to fill the seat she's in today. I would hate to look to any of you and tell you what words need to come out of your mouth and pass that in a formal motion. I think Mayor Chop has heard and read the report as we all have today, and I'm wondering if there is a friendly amendment for Mayor Chop to reconsider what her comments would be, and additionally make comments on how she plans to communicate moving forward, and that may include some of Mr. Mascaren's comments about not repeating her actions.
Okay. Thank you, Councillor Martin. Okay, we do have a recommendation. Pardon me? We have a recommendation that's been proposed, okay? I'm going to ask the Deputy Clerk to read it for us.
Through the chair to committee, moved by Councillor Van Passen and seconded by Councillor Rabbits, that the Integrity Commissioner report dated April 9th, 2019 be received as information, and that the Mayor recognize Council's displeasure with her actions at the Council and Committee meeting of January 8th, 2019, and further that the Mayor offer a formal apology no later than May 31st, 2019.
Okay. Does everybody understand it? Is there any further discussion on that matter? I will call the vote. Those in favor? Those opposed? That's carried. Thank you. Mr. Mascaren, thank you for coming to Norfolk County. Okay.
Thank you, Mr. Chair.
Appreciate you being here.
Thank you, committee.
And thank you for your report. Those are always tough ones, folks. And in 34 years of being a counselor, that's probably one of the most difficult moments that I've had to deal with. Okay. We will be going into closed session to deal with the county solicitor's memo to staff report CS 19-03 options and considerations for Friday the 13th. Can I have a mover and a seconder for the following? The committee move into closed session at 3:48 p.m. to discuss matters pursuant to section 239(2)A, F, and H of the Municipal Act 2001 as the subject matter pertains to the security of property of the municipality. Advice that is subject to solicitor-client privilege, including communications necessary for that purpose and information explicitly supplied in confidence to the municipality or local board by Canada, a province or territory, or a crown agency of any of them. A mover, Rabbits and Martin. Those in favor? That is carried. Thank you. We'll be going in camera.